Hi, everyone, and welcome to another edition of Public Health Career Conversations. I am very happy to have with me today Dr. Stacey Mearns, who is the Director of Resilient Health Services at Resolve to Save Lives in the US. But Stacey is based in the UK. So, Stacey, thank you so much for taking the time out today to kind of unpack with us your career journey in public health.
Thank you. Thank you for having me.
Great. So the first question really is exactly what I said, your journey in public health. So, a lot of the younger colleagues coming out of undergraduate training, especially medical training, are thinking through their next steps. And public health has come to the fore post-COVID as a interesting and sort of viable career, long-term career option, and sort of more understood or more visible in terms of what you can do within the public health space. But a lot of younger colleagues are grappling with the decision. What factors do you take into consideration when you decide to move into public health? What were some of the steps that may need to have been taken? So can we maybe start there? Maybe if we can, look back at your journey, what were some of the factors that you, or that sort of, I'm not going to say that you had to think about when you decided to go into public health?
Yeah, sure. And I think, for me, it was a journey, and I think a series of sort of reflections and decision points. And I think for me, just going back, so when I was, a medical student, completing my medical degree, obviously we learned about public health as part of that. So that was probably where I first started gaining some kind of exposure of what sort of public health is. But I would say it was probably related to the experiences I had abroad working clinically as a doctor were probably the most informative in terms of decision making for me. So, when I was in my last year of medical school, I did a medical elective in a rural clinic in India. And then as a junior doctor, I also spent just under a year working at a government hospital in Sierra Leone. And I think when I reflect back on those experiences, I think they left me with more and more questions about public health and the importance of public health. And I think, when you're practicing clinically in settings where, people have to pay to access health services, where there are, challenges with the supply chain and you don't necessarily have the drugs to be able to treat patients, or, there's challenges with laboratory capacity. And so your ability to even diagnose certain conditions, when there's not enough healthcare workers to actually meet the demand. And then also thinking more broadly about, the conditions in which people by and large live, and actually how much that affects their health at baseline. So, not having access to clean water, for example. So I think those experiences, as a medical student and as a young doctor, working in situations like those, I really started to see actually how important public health is if you want to be impactful. That actually there are big systems issues, be that policy issues, be that systems issues that are really needed if we're to actually improve health. And I think those experiences were probably the most instrumental for me in deciding, actually, I want to explore public health more. I want to learn more about public health. And so a few years after those experiences, I then took a year out of working clinically as a doctor and completed my master's in public health. And the decision to do that was informed by those experiences. And that was a great year to sort of deepen into public health, into my understanding of public health. And I had, high hopes that at the end of my master's, I would go abroad again, but this time, looking for an opportunity or a role that was more public health framed than clinical. And then interestingly enough, at the time I finished my master's was, at the onset of the West Africa Ebola crisis. And actually what they needed was clinicians to go and work. So off I went to Sierra Leone, actually as a clinician initially, with my MPH in my pocket. But, during my time there, I spent the initial sort of 4 or 5 months working clinically in an Ebola treatment unit, and then started to work more on what I would say the kind of public health aspects of the response out there. And then I kind of just sort of, fell into public health, I would say. I never quite made a decision to say, right, now I'm going to stop clinical medicine and do public health. But it ended up being, the clinical work took me into public health. And, after 2.5 years in Sierra Leone, I then went into, working more broadly in humanitarian health and looking at both, setting up and strengthening clinical programs in humanitarian settings as well as public health programs. But, I look back now, somewhat 10 years later, and it's been, over 10 years since I touched a patient, and it feels like it was somewhat of an accidental decision in some ways. But I think another challenge also, and, again, this will vary depending on, which country you have trained in and practice in, and also it's different with time. But, certainly, 16 years ago in the UK, it was very hard to combine and do both public health and clinical training postgraduately. I think now that situation's changed, and now there is a possibility to concurrently train, do your postgraduate training in clinical medicine alongside, formal public health training. But I think the lack of those options at the time for me really forced me to sort of felt like I had to choose one over the other. And I think fundamentally the decision came down to, impact and being impactful. But I definitely miss clinical work, and I miss that one-to-one impact and interaction of that. But that's sort of in a nutshell the journey that I've been on.
Thanks, Stacey. It's a really great insight into your initial journey. As you say, it's a journey, and that's what we've been trying to articulate to the colleagues, that you're not expected to figure this out from, immediately after medical school or your service, in-service years. And it does take a bit of sort of trial and error and figuring out your interests before you get there. But I wanted to pick up on a few things. So I think what is interesting from what you've said around having done the MPH and then going to work in Sierra Leone, and sort of taking that opportunity to utilize your MPH skills, even though you were contracted to do more sort of response work as a clinician. I think that's a really great insight for anyone who is trying to bridge that gap between an MPH and clinical skills, because sometimes you might not be in a role that allows you to utilize your public health skills. And so in this way, at least, we've always said to the younger colleagues, look for opportunities like that you can. It may not be, and then you can transition, into a more formal role, but start trying to utilize your skills in some way, or offer them up to the people that you're working with. So I think
just picking up on that, Atia, I think what's quite interesting is I think where there are really rich opportunities for experience is actually in outbreaks, because I think in an outbreak situation, I think that's where you really acutely see the clinical and the public health kind of partnership that's needed. I mean, we all saw it, with COVID, but with any outbreak, those two things coming together really acutely, you kind of see where one blends into the other and where one needs the other. So I think if for anyone who is from a clinical background and is thinking about public health, I think those types of an outbreak sort of situation, I think is quite interesting for some of that learning that really holds both of these pieces together quite nicely, I think.
So that actually brings me to a question that I have. But before I get there, I just want to say to the last point that you made just now around sort of being able to do clinical work and public health at the same time. And I've done a master's in public health, but then there's the specialty in public health, which I've also done. And in our, I'm not quite sure exactly how the UK is set up, but in South Africa, once you're a specialist in public health, you are sort of precluded from doing a lot of clinical work for various reasons. The regulatory body, the clinical the competencies for public health medicine specialists. And a lot of colleagues are struggling with that because they feel like we've got clinical skills and they would like to be able to utilize them. And it's quite a big point of discussion at the moment. We haven't solved it yet, because there's some people who went into public health because they didn't want to do clinical medicine. But then there's people who actually still want to retain their skills. So it's a bit of a negotiation around when you say you're a public health medicine specialist, where does your clinical skills stop and your public health skills begin, so that you can practice either, but in a safe manner. So I just wanted to make that point. But going to the point around working in outbreak response, there's also a very specific reason why I asked you to please do this interview with me, and that is because of your experience in humanitarian settings. And I think for a lot of colleagues, or for many of us, you go into things and you don't really know exactly what it's about, and what the day-to-day is like, what the conditions are, etc. So maybe if you can just highlight some of your experience in these humanitarian settings and what it is like, so that somebody who does decide to take your advice and say, oh yes, I can bridge the clinical and the public health there. But then, I mean, these are really difficult settings to be in. They're not, easy. So yeah, if you could maybe just, talk through that, and also how do you go about finding these jobs? Is it like, what was the process for you, basically?
Sure. I mean, in terms of what it's like, I guess it's quite hard to find. It's quite hard to describe in the sense of, there's very few things that are the same from one humanitarian emergency to the other. Often because context can be hugely different, and the type of emergency can be very different. If you're dealing with a very acute crisis, like for example, I was in Bangladesh during the mass displacement of the Rohingya people, where in a very small space of time you've got over 1 million people that are just displaced. Very different to time I've spent supporting health programs in the Democratic Republic of the Congo, where you've got long-term sort of chronic insecurity. And then the type of emergency, working on an Ebola response is very different to working on a flood, for example. So I think in terms of commonalities, I think unpredictability, high stress and pressure, and quite demanding. But I'm someone that kind of enjoys those things. So I think, it's each to their own sort of personality. But what I did find interesting actually is when I was working clinically, I did really enjoy the kind of acute medicine side of that. And I noticed the things that I enjoyed and the skills that I had that lent well to acute medicine actually lent well for being working in humanitarian setting, where actually there is that unpredictability, there is a level of chaos, things change very quickly, you have to work at a very high pace. But I think these settings are extremely important, and extremely rewarding. I mean, I think all of us that go into health, to some degree of another, all firmly believe and want to be of service and to help, and believe in the right to health for all. And I think that really gets called into question most acutely in humanitarian setting, where people are arguably at their most vulnerable and in their most in need when something like that's happened. So for me, that was the kind of draw into those settings. I think as well, it was kind of an accidental draw. I mean, if you'd have talked to me, 10 years ago, I probably would have told you that I was not humanitarian and more interested in the development side of things. And I think, again, going back to Sierra Leone, which is quite interesting, I first worked in Sierra Leone in 2009. So when the Ebola outbreak started there, I had a lot of ties to the country and a lot of friends still in the country. And so I wanted to go back and, be of service and be of help. And so I accidentally almost found myself in a humanitarian emergency. And at the end of that, was like, no, I quite like humanitarian emergencies and the sort of settings. And from there went into humanitarian emergencies. But again, it was a sort of accidental decision making, really. I think in terms of looking for jobs and opportunities, so one is recognizing there's a couple of different ways of doing this in terms of who to work with. I mean, I'm very lucky. I have experience working with NGOs, with the government, with the UK government, and with WHO. And each of these sort of players are always present in humanitarian settings. The UN agencies have very important roles to play. The NGOs have very important roles to play, as well as government agencies too. So there are different ways in which you can work in that space. And also, again, different ways to either, to volunteer or to, opt for a paid position as well. Volunteering is usually, I think, a good way to sort of gain experience and, I guess, test the waters. I mean, especially if you're, thinking about, transitioning from clinical medicine into public health, or thinking about, do I want to incorporate public health into my career? I think, getting some experience, in short bursts, maybe 3 months placements or 3-month volunteer opportunities or 6 months, I think will help with that decision making. Sometimes I think we feel that we have to just make this one big decision. And actually there are ways in which, good NGOs for that, MSF is a great one where people can volunteer and as clinicians for anywhere from sort of 3 months up to 6 months, and as part of that gain that sort of exposure of what's it like to work clinically in some of these different types of settings, and start to see where that public health piece comes to the interface of the clinical work. It also, I think one of the challenges with public health is it can feel really overwhelming. I mean, it's huge. There's probably 1,000 different careers one could have in public health, right? And so I think this is where, further study and an MPH is useful in terms of, one, kind of building that broad base understanding, but also starting to sort of unpack what you like and what you don't like. Like, are you into the policy side of things? Are you into the health, economic side of things? Is it the research? Is it the advocacy? Is it service delivery? And I think it's helpful when we can start to answer some of those questions ourselves by sort of thinking, I don't like these things, and actually I'm really interested in these things. Again, it helps to narrow down options when you're then thinking about, okay, I want to look for a voluntary placement or a volunteer opportunity or a paid position. The kind of organizations you would search for would be different depending on what aspects of public health sort of interested you.
Yeah, thanks for that, Stacey. I want to say, firstly, the point around volunteering. I will say my awareness of public health, because I think, unlike, there's sort of two types of people that I've come across in public health. There's those who remember studying public health in undergrad, even though it was like a small block, and those who didn't pay attention to it. I was the latter. But my sort of awareness around public health actually did come during a humanitarian crisis in South Africa, and where I ended up volunteering with Gift of the Givers and MSF. And that was a really interesting lens for me into it, even though I didn't go down that path long term, but it did give me some idea of the decisions that need to be made and the logistics on the ground, etc. So I think that's a really great piece of advice. And for people who are watching who may be from South Africa, Gift of the Givers is a huge organization run also by a medical doctor. And so a lot of relief work. So that is an opportunity. And they do a lot of work in South Africa and in Africa and internationally. So there is opportunities to, volunteer for them as well. So I think that's a really great reflection.
And I think actually as well, in terms of volunteer opportunities, I think the best place to sort of start and think about this is within your own community. I mean, starting to volunteer in your own community is eye-opening in terms of a public health perspective, especially if you're used to being a clinician, in starting to understand some of those broader, more sort of socioeconomic aspects that drive health in many ways. One of a big issue in community where I live is around homelessness. And actually, working with homeless populations, working in soup kitchens, again, can help you just start to see some of these wider factors that influence health from a non-clinical lens, which then becomes helpful when you start to marry that with your clinical understanding too. So, I know we've been talking a lot about the kind of global stage and humanitarian emergencies, but I think just starting with, and obviously I think there's easier access as well when you think about your own community and volunteer opportunities as well.
That's a really great point. I think also a lot of these organizations are sometimes really glad to just have an extra set of hands or someone to do some more thinking around what it is that they are trying to achieve. I know I used to advise medical students here in South Africa who were running a clinic for homeless people and giving them some sort of marrying my public health brain with the clinical training that I had and just helping them to think through a program. So again, I think that's a great piece of advice around, starting where you are, because not, as you say, not everyone can leave their family or their job or whatever to go for 3 months and test out, and assisting with an outbreak or assisting with a crisis. So this is another avenue towards that. So thank you. I think my next question then is around, now you've transitioned completely out of the humanitarian space, but you are dealing with work that is adjacent to it from a public health, field of study, for example, and dealing with resilient health systems. So what was that transition like for you? And, how, if you can maybe just walk us through some of the type of work that you are undertaking and how your actual practical experience then translates now into the more sort of high level policy or implementation work that you're doing.
Yeah, and I think, as I said, that whole journey has been, quite gradual and sort of evolved in many different ways. But I do feel, whilst I, no longer practice clinically, so I no longer treat patients, I do and I have, on a fairly regular basis, utilize my clinical skills and that clinical knowledge in what I do. So it's not a case of once you stop practicing clinically, you just forget all of that and kind of close the door to it. I think it then becomes really interesting in how, I think someone who's clinically trained working in public health versus someone not clinically trained working in public health, I think both of these are really great entities when they work together, because you look at things slightly differently. And from my own personal experience, I think when you're thinking about, health systems and you're thinking about, how to strengthen health service delivery, I think there's huge advantage to understanding what it's like and having experience of working as a healthcare worker. For example, a lot of the work that my team currently do at Resolve to Save Lives is geared around how do we make health services and health service delivery resilient, so able to withstand different types of emergencies. How do we empower healthcare workers to, you know, have the knowledge, the skills and the confidence to not just do their day-to-day job in providing clinical services, but be able to cope with situations when we have outbreaks of Ebola or COVID or other things. And I think, you know, understanding what it's like to be a healthcare worker and some of the different pressures you feel as a frontline healthcare worker, the impact of different sort of pieces of the system, the importance of, you know, the supplies, the burdensomeness of reporting and medical records, and some of these kind of nuanced things, I think becomes really helpful in terms of how you start to think about not just, you know, problems and challenges, but how you kind of approach solving problems and challenges. Again, you know, a lot of the work I do is centered around outbreaks, epidemics and outbreaks of infectious diseases. And so I think understanding those diseases and the you know the clinical aspects of those diseases, how they affect people, I think becomes really important, because you know public health and clinical medicine is fundamentally both about people, just at different levels. You're either dealing with people, you know, on a level of kind of personal one-to-one when you're working as a clinician, you have one patient, or you're dealing with people at a population level. And I think sometimes when we work a bit more removed and we're sort of knee deep looking at systems and trying to improve systems, we can forget the people aspect. So, you know, how do we ensure that we are bringing that person-centeredness, that patient-centeredness when we think about health systems? Because at the end of the day, we want health systems to be strong or to be resilient fundamentally for people, right? Not just for sake. So I think for me, like there's many different ways I find that, you know, my clinical experience or clinical skills or knowledge kind of either creeps into my work or kind of takes central stage of how I think about, you know, problems and approach problems, and where I seek a lot of motivation.
So I think that last point is really important, not only for someone who studied medicine. I think if you've done any sort of biomedical sciences, that sort of understanding of patients, the health system, the body, all of that does. And I think COVID was a really great example. For example, you know, we needed the infectious disease specialist to say, well, this is how it's transmitted. And then people were like, well, then we should wear masks. The public health, you know, fraternity was like, well, if that's the transmission of the virus, then we should wear masks. And everyone has to bring their area of expertise and their lens to it. And because otherwise you can get in danger of seeing things in a very specific way. And everyone has different experiences of the health system. So the nurses experience the health system very different from a doctor, from a physiotherapist, etc. So, and similarly to your point around, we need different types of public health practitioners. So medical doctors are not the only public health practitioners there are out there. And, you know, there's different cadres of public health practitioners. There's people who are from a wider social or medical science background that have done an MPH, and so have a very different view of the health system based on their background and their experiences. So, and a lot of public health is multidisciplinary, you know, work across, not just within the health sector, but even outside. So working with departments of finance and agriculture and all of these stakeholders because of this the social determinants of health. So I think that's a really great reflection there.
And I think a good framing for that is around what is the difference then. And the difference is, no matter what way you look at this, is about scale. That is the fundamental difference between, you know, clinical work and public health work. So that could be the difference between me as a clinician treating a patient in front of me with high blood pressure versus as a public health specialist thinking about how do we reduce high blood pressure for the whole population? What are the policy changes, the nutrition, you know, implications, etc. Likewise, I might be a biomedical scientist in one laboratory in a hospital, looking at how I improve the quality of the lab services in this lab in a hospital. or I could be thinking about national laboratory capacity and quality assurance. And so I think that's another helpful lens, is it's about scale, and actually taking what you do in a clinical way, which could be as a doctor, as a nurse, as a physio, and thinking, what does this look like at scale if we're to think about this from a population perspective?
Yeah, I think that's a very great example because I think sometimes it's easier for people to understand how a clinical medical background as a doctor would translate into public health, but it's maybe sometimes less well understood for people who are not doctors. So as you say, exactly that, for somebody who is in laboratory services, what exactly would that mean to transition across to public health, and how does that skill set then get taken up into at a population level? So, Stacey, my last question for you is really the part around the advice, and I know it's a double-edged sword, because sometimes we look back and we think, oh, okay, if and the reason why we do this is because I think a lot of people hear these conversations and they think all of these people had their lives nicely mapped out, or the decisions were just sort of linear. And part of this is to show that, there is, there's sometimes a lot of self-doubt, there's sometimes a lot of factors that have to go into it. And so the question really is around, if you were looking back on yourself, or, advising somebody in your position 10 years ago, what is some of the advice that you would have maybe had appreciated hearing from someone senior?
I think don't be afraid of change. And I think knowing as well that, like, the amount of times, throughout my career, I have asked myself, what on earth am I doing? Have I made the right decision? Like, yes, right. We all have that, right? I think it's part of the human condition. I would change, nothing about how my career's evolved, and I feel very privileged and honored that, I've been able to do the type and sort of scope of the work that I've done. But I think for me, that's the big the big key thing is change. Change is not a bad thing. Change is actually really important, because it's what helps us to keep learning and keep growing. So whether or not that's, working, deciding to do some public health work outside of clinical work, deciding within public health to, work at different levels, work in different sort of thematic areas with different organizations, different countries, change is really helpful. And I think that's where, breadth and depth of experience comes from. And I think both of those things are really important if we want to be impactful in being in service and being of use. And I think so, embracing change, and along with that, knowing that no decision is reversible. It's another part of the human condition too, that we struggle to embrace change and make decisions for fear if we get it wrong. If you get it wrong, you make another decision, right? So yeah, don't be afraid of change, and no decision is reversible. And
Thanks,
go and
Daisy.
enjoy.
That reminds me of something that I heard the other day, where someone said that we do not have the option of knowing the results of a different decision. So we don't live in parallel universes. So you don't know if you had taken another path, what may or may not have happened. So the advice was, don't stress about making the right decision, make the decision and then make the decision right. So either make the most of it, or change what needs to be done. So that just reminded me, what you were saying reminded me of that. And I think it's a really great piece of advice for anyone who's feeling pressured early in their career to have it all figured out, or to specialize, or to pick a career path, or pick a field within medicine. You can always change, and nothing that you do or study is wasted. You will utilize those skills, even if you may not realize it at the time. You will utilize them at a later point in some way or the other. So I like that last reflection from you. Thank you. So I've covered my little 3-question agenda. Any last reflections from you before we close?
No, nothing further from my end. Just yeah, I guess encouraging people, and I think yeah, maybe reflecting on what you've just said. Actually, I think sometimes when faced with the privilege of options and lots of decisions, we can sort of overwhelm ourselves. And I think, you know, nothing holds us back in terms of, you know, if I study the A instead of B, what would that mean, right? You know, gaining more study, gaining more experience is only a positive thing. And I think probably the most, and I, you know, certainly have never had a plan in my career, so to speak. I still don't have a plan. I'm enjoying what I do, and I think I've accepted that life evolves, and I will evolve, you know, with it. And I think what has been helpful to sort of ground me in that journey is actually, you know, being really in tune with what my values are and why I want to do this work. And so, you know, ensuring that my motivations and my values for doing this feel authentic and feel real for me, and using that as my compass rather than trying to figure out what I'm going to be doing in 10 years' time, because you know, who knows? So yeah, but thank you for having me. I really enjoyed the conversation.
Thank you. And those were lovely words to end on, so I'm not going to even add anything to it. Thank you for joining us. I really appreciate you taking the time out, and I'm sure anyone watching this will find either some inspiration to look further into, you know, humanitarian work or volunteering, or even just feel less pressured to make the right decision right now. So thank you so much, Stacey. Have a lovely day.